Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. 0.11 Causes of hip pain in athletes. Muscle strains around the hip and groin area are common in athletes. A hip pointer, or contusion to the iliac crest, is treated with RICE, rest, ice, compression, elevation, and NSAIDs. Hip bursitis causes chronic pain that tends to recur even after treatment. Other common hip injuries in athletes include osteitis pubis, snappinghipsyndrome, hip labraltears, femoroacetabular stress fractures, sports hernias, and hip arthritis. Treatment for these conditions often involves a combination of rest, NSAIDs, physical therapy, steroid injections, and in some cases, surgery. Severe cases of hip injury, such as subluxation or dislocation, are rare but require urgent medical attention and prolonged recovery. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. =speak